Hi everyone. Today in this video we are going to discuss about cyclobenzaprine. What is this drug cyclobenzaprine? This is one of the skeletal muscle relaxant which is centrally acting, and this drug is having 3 rings where its structure is somewhat similar to TCAs, tricyclic antidepressants. Because of structural similarity, this cyclobenzaprine also acts as TCAs, thereby inhibits the reuptake of neurotransmitters such as norepinephrine as well as 5-HT. Even this drug acts as muscle relaxant. It is not showing its action on neuromuscular junction. It mainly acts through the central nervous system. So from the brainstem, the neurons can end at the spinal cord, which are extending to the muscle through the alpha and gamma motor neurons. These alpha and gamma motor neuron activity is somewhat reduced by cyclobenzaprine, but it is not directly acting on the skeletal muscle. It acts on the brainstem, thereby controls the motor neuron activity. So this drug is a centrally acting muscle relaxant. But this drug should be given for a short period. Around 2 to 3 weeks, this drug should be used in order to minimize the central side effects of this drug. Similarly, this drug is not indicated for any cerebral and spinal cord disorders which are responsible for any spasticity. For instance, this drug is not indicated for cerebral palsy, as this drug is not acting at the higher centers, but it reduces the motor neuron activity, thereby it relieves the muscle spasm. So it is only used for local muscle spasm as adjunct in the musculoskeletal disorders. Now let us see the chemical nature of this drug. So this is the structure of cyclobenzaprine. You can see that it is having the 3 rings which are fused. So it is a tricyclic compound which is having some structural similarity with TCAs, tricyclic antidepressants. If we give the name for this compound, we can identify the amine as the principal functional group. So this is 1, 2, 3. So simply it is a propane 1 amine. On the nitrogen 2 methyl groups are present, so N and dimethyl. And at the third position, it is attached to a tricyclic ring system. So what is the name of this tricyclic ring system? In order to give the name, let us give the numbering to this tricyclic ring. So this is 1, 2, 3, 4, 5. So it is attached at the 5th position to the propane 1 amine chain. And simply it is a dibenzocycloheptene ring. So we can write this as 3-dibenzo A, D cycloheptene, which is attached to the propane amine by double bond. So we can represent with the suffix ylidene. So 5-ylidene. It is attached to the 5th position by double bond. And finally, saturation is present at the 5th position, so 5H. That is a complete name of cyclobenzaprine. Even this is not the IUPAC name, but this is the name commonly used for this drug. Now let us see how this drug acts. As we have discussed, cyclobenzaprine acts centrally and it reduces the motor activity of alpha and gamma neurons. But it also acts as antagonist at 5-HT receptors as well as alpha-1 receptors. So within the CNS, presynaptic neurons are storing 5-HT. This 5-HT can be released and it can act on postsynaptic receptors which are expressed with 5-HT 1A receptors as well as 5-HT 2A receptors. Now, when action potential reaches to the presynaptic neurons, calcium can enter to produce exocytosis so that this 5-HT is going to be released and it can act on both of these receptors. In this way, it can produce postsynaptic activation. But the released 5-HT can also be taken into the nerve terminal by SCRT, serotonin reuptake transporter. So through this transporter, 5-HT can be taken again back to the nerve terminal. Now, cyclobenzaprine is one of the drugs which can block this SCRT transporter so that 5-HT is not going to be taken into the nerve terminal. So it can inhibit the reuptake of 5-HT. At the same time, this drug can also act as antagonist at 5-HT 2A receptors. Thereby, it can reduce the activity of 5-HT, resulting in the decreased motor activity. Similarly, at the adrenergic neurons, again the postsynaptic neurons are expressed with alpha-1 receptors as well as alpha-2 receptors or beta receptors. Now, when the action potential reaches to the presynaptic neurons, norepinephrine can be released and it can act on both of these receptors. This produces postsynaptic activation And alpha-1 receptors can increase the motor activity resulting in muscle contraction. Just like the 5-HT, norepinephrine transporters are present on the presynaptic neurons which are responsible for reuptake of released norepinephrine. So cyclobenzaprine again blocks these norepinephrine transporters so that the reuptake of norepinephrine is inhibited, and it also acts as antagonist at alpha-1 receptors which reduce motor activation. In this way, cyclobenzaprine acts by multiple mechanisms, and its action is to reduce the activation of 5-HT2A receptors as well as alpha-1 receptors. What are the precautions? One of the important precautions of cyclobenzaprine is that this drug can increase the serotonin syndrome. Since this drug is going to inhibit the reuptake of 5-HT, it can increase the serotonin syndrome. So this drug can produce anxiety, agitation, hallucinations, tremor, and increased sweating. All these symptoms can be observed in the patients because of serotonin syndrome. And particularly drugs like SSRIs, selective serotonin reuptake inhibitors, SNRIs, selective norepinephrine reuptake inhibitors, TCAs, tricyclic antidepressants, MAO inhibitors, all these drugs, when they are combined with cyclobenzaprine, they can increase the serotonin syndrome. So this drug should be carefully combined with other antidepressants. Since cyclobenzaprine is structurally similar to TCAs, it can also produce few of the side effects related with the TCAs. So this drug can activate the cardiovascular system, resulting in the increased heart rate, leading to sinus tachycardia, and it can also increase the risk of myocardial infarction and stroke in the patients. Similarly, this drug can act on the central nervous system so that it can produce some dizziness, somnolence, the sleepiness in the patients. Because of this, the cyclobenzaprine can increase the activity of other CNS depressants. So when this drug is combined with alcohol or drugs like tramadol, the CNS depressant activity is increased, which should be carefully monitored. Similarly, this drug can produce few of the anticholinergic side effects. One of the important side effects is on the eye, so this drug can increase the narrow angle glaucoma. It increases the intraocular pressure, and it can also produce some blurred vision. Even it can produce some dry mouth and urinary retention within the patients. This drug is not preferred in the elders, so it is contraindicated because of less safety, and it is also contraindicated in the patients with any hepatic impairment because this drug is mainly eliminated by hepatic system. What are the side effects? The important side effects of this drug mainly include dry mouth, dizziness, fatigue, constipation, nausea. Similarly, other side effects mainly include blurred vision, some dyspepsia can be observed, somnolence, unpleasant taste, and palpitations can be observed with this cyclobenzaprine. How it is given? This drug is available as tablet, which is film coated and immediate release. It is available at 2 strengths such as 5 mg and 10 mg, and it is also available as extended release capsules which are available at 2 strengths such as 15 mg and 30 mg. And the initial dose depends on the type of dosage form. In the immediate release tablet, the initial dose is given as 5 mg given thrice daily. So the total dose per day is 15 mg. This dose can be increased slowly up to 10 mg given as thrice daily so that the total dose is 30 mg. But when it is given as extended release capsules, the initial dose is started at 15 mg given as once daily, and based on the efficacy the dose can be increased up to 30 mg either given as a single dose or as divided doses. So that's about this drug cyclobenzaprine, which is a centrally acting skeletal muscle relaxant. This drug acts centrally, thereby reduce the motor activity of alpha and gamma neurons. It also reduces the reuptake of neurotransmitters such as 5-HT and norepinephrine. Finally, it also acts as antagonist at 5-HT2A receptors as well as alpha-1 receptors. By all of these actions, it reduces the motor activity. So this drug can be used as adjunct in the musculoskeletal disorders associated with muscle spasm. So that's about this drug cyclobenzaprine. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.